A lot of people think getting older means signing a secret contract that says, "Congratulations, you now get stiff hands, belly fat, brain fog, swollen ankles, 3 pill boxes, and a favorite pharmacy." And the crazy part, most people accept it. They say, "Well, I'm over 65 now. What do you expect?" No. That mindset is exactly what I want to challenge today, because I promised you in a previous video, the one called 65 Years Old and Thriving on an All-Meat Carnivore Diet, that I was going to keep showing up for my senior audience. And today, I'm keeping that promise. So if you're in your 60s, 70s, or beyond, and somebody told you it's normal to feel inflamed, stiff, puffy, forgetful, tired, and heavier than you want to be, I need you to hear me clearly. That may be common, but common and normal are not the same thing. Sometimes what we call aging is really just chronic inflammation wearing reading glasses. And once you understand that, everything changes. I've had people tell me, "Dr. Hampton, I thought my hand stiffness was just part of getting older." And then they changed how they ate. And suddenly they could close their hands better, move with less pain, even snap their fingers again for the first time in years. Now listen, that's not magic. That's metabolism. That's the body finally getting a break from the inflammatory chaos. Because one of the biggest lies we've been sold and more inflamed just because the calendar keeps moving. Now, yes, aging happens. We all age. I'm not here to tell you that eating ribeye or ground beef is going to make you 27 again. But I am here to tell you that many of the symptoms people blame on age are often driven by things we can actually influence. Things like insulin resistance, chronic inflammation, poor protein intake, electrolyte imbalance, stress hormones, visceral fat, and yes, sometimes autoimmune activity that has been quietly smoldering in the background for years. Now let's start there. One of the things I hear from older adults all the time is this: "My joints are stiff. My fingers don't work the way they used to. My labs show inflammation. My autoimmune markers are elevated." And many people are told directly or indirectly to just live with it. But here's the question nobody asks enough. What is driving the inflammation in the first place? Because if the immune system is constantly activated, if the gut is irritated, if blood sugar is swinging up and down like it's on a roller coaster at Six Flags, and if seed oils and ultra-processed foods are showing up daily like uninvited house guests, then of course the body is going to protest. That protest may show up as swollen knuckles, pain, fatigue, brain fog, skin issues, digestive trouble, or labs that keep waving red flags. And this is where a meat-based, low-carb, or carnivore approach can become really powerful. Why? Because it simplifies things. It removes a lot of the common dietary irritants. It lowers the glucose and insulin roller coaster. It provides highly bioavailable protein. It gives your body the building blocks it needs to repair tissue, support muscle, support immune balance, and calm down the inflammatory noise. In other words, instead of constantly poking the bear, you finally let the bear go to sleep. And when inflammation starts going down, people often notice something beautiful. They move better, they hurt less, they think more clearly, and they start to realize, wait a minute, maybe I'm not falling apart. Maybe I've just been underfueled and overinflamed. Now let's talk about something else that comes up a lot in seniors. Feeling puffy, fluid retention, that frustrating sensation that your rings fit tighter, your socks leave marks, and your body seems to be holding onto water like it's preparing for a drought. A lot of older adults, especially those dealing with hypothyroidism, cortisol issues, medication changes, and during lower carb transitions, run into this. And the mistake many people make is assuming that if they're retaining fluid, the answer must be less salt. But sometimes the opposite is true. This is what I call the salt paradox. When insulin levels are high, the body tends to hold onto sodium and water in one way. But when you lower carbs and lower insulin, your kidneys start dumping sodium more aggressively. That can leave you depleted. And when sodium drops too low, the body can activate stress hormones, including aldosterone and cortisol. And suddenly you feel weak, lightheaded, crampy, tired, and yes, sometimes even more bloated. The body is basically saying, "Excuse me, I'm trying to survive here." So for many people, especially seniors, adding quality salt strategically can help. Not because salt is some magic fairy dust, but because your body needs the right electrolyte balance to regulate fluid properly. That's why I've talked before about salt loading. And for older adults, this can matter even more. Now, of course, use common sense. If you have heart failure, kidney disease, uncontrolled blood pressure, or you're on medications that affect fluid and electrolytes, this needs to be personalized. But for many people eating low carb, the answer to feeling puffy is not always less salt and more suffering. Sometimes it's better mineral balance. Sometimes it's lowering insulin. Sometimes it's reducing processed foods. And sometimes it's just finally giving the body what it actually needs. Now, let's move to two things that terrify people as they age: belly fat and memory changes. Because a lot of folks think these are separate issues. They're not. Visceral fat is not just extra padding. It's metabolically active tissue. It produces inflammatory chemicals. It worsens insulin resistance. It disrupts hormone signaling. And it increases the kind of metabolic static that affects not only your waistline, but also your brain. So when someone says, "Dr. Hampton, I can't lose belly fat, and I don't feel as sharp as I used to," my ears perk up. Because the brain is an energy hog. It needs a steady, reliable fuel source. And when your blood sugar is unstable and insulin resistance is high, the brain can struggle to access energy efficiently. That can translate into foggy thinking, low motivation, poor focus, and memory concerns. Now, I'm not saying every memory issue is caused by visceral fat, but I am saying the metabolic connection is real. And when you improve metabolic health, you often improve brain function too. That's one reason nutrient-dense animal foods can be so helpful. They provide protein, iron, B vitamins, choline, creatine, carnitine, and healthy fats that support the brain and body. And unlike the standard snack foods many seniors have been taught are harmless, these foods don't keep poking insulin every few hours. They nourish, they satisfy, they stabilize. That's the key. Stable energy, stable appetite, stable mood, stable brain. And the beautiful thing is, you do not have to be perfect to start seeing progress. You just have to stop worshiping typical aging like it's some kind of medical commandment. Because thriving after 65 is possible. I've seen older adults regain strength, reduce inflammation, improve mobility, drop belly fat, think more clearly, and feel hopeful again. Hopeful, that matters. Because when people lose hope, they stop trying. They start negotiating with decline. They say things like, "I guess this is just my life now." And I want to lovingly challenge that. No. Your story is not over. You still have life to live, people to love, wisdom to share, purpose to walk in. And I want those years to be vibrant, not just technically alive. I don't want you merely existing with a heating pad, a recliner, and a bowl of oatmeal that spikes your blood sugar before the weather report is over. I want you thriving. So if you're a senior watching this, or you love someone who is, here's what I want you to remember. Don't assume every symptom is just age. Ask better questions. Could inflammation be driving this? Could insulin resistance be playing a role? Could low protein intake be making me weaker? Could electrolyte imbalance be making me feel puffy and tired? Could visceral fat be affecting my brain as much as my waist? Those are better questions. And better questions lead to better outcomes. So let this be your encouragement today. Don't accept typical when thriving is still on the table. Listen to your body. Use common sense. Work with a doctor who is willing to look deeper. And remember that the goal is not to chase you. The goal is to reclaim function, joy, clarity, strength, and freedom. You have more time to live. Let's make those years count. And if this message speaks to you, drop your age in the comments and tell me where you're watching from. I'd love to hear from my senior warriors. And if you haven't seen my earlier video, 65 years old and thriving on an all-meat carnivore diet, make sure to check it out right here on the screen. Because this conversation is not over. We're just getting started.